WeCan is a national education program from the National Institutes of Health that helps to provide parents and caregivers of youth the tools, the strategies that they need to help children maintain a healthy weight. We focus on improved nutrition, increased physical activity, and reducing screen time in an effort to mobilize communities and partners and the media around a common message, a common theme that we think will be helpful for everyone out there to rally around this cry for the need to reduce overweight in children.
We had one woman, Yvonne Barrow, who came to the program. Her son was overweight, and she really wanted to learn how to maintain her Latino recipes. So we did a lot of how to adjust the sodium and the fat and really discuss portion sizing. And then we gave her wonderful ideas that she could do physical activity with her son that are inexpensive. And so she had a contest of walking with her son around Castle Island. And we also provided pedometers, and the two of them had a contest, and they just loved it. And he did so well that she purchased a bicycle for him to encourage him to continue his physical activity.
And then we've been pretty successful, both ourselves as well as through our partners, in achieving pretty substantial media coverage. Right now our estimated reach is nearly 700 million.
It's a great opportunity. We are already working out in the communities on multiple levels around cardiovascular disease and diabetes and obesity prevention. And WeCan seemed like a really good fit for us. We really like what you're doing at the community level, and we think we could be a good partner in helping maybe leverage some resources for more WeCan communities.
Well, one of the things that we liked about WeCan is it's based on research, so that made us feel really good that it's a tried and true information for people to use. The other thing that we like about it is I call it cafeteria style. You can pick and choose, and even we find that a lot of people have something going in their company or community, but you can take a piece of the WeCan program and integrate it into whatever you're currently doing. So that's what we've liked most about WeCan, and also the great support we've received from the WeCan staff.
We've been running a WeCan program at one of our clinics in Columbia Heights, about a mile from here, for the last almost 2 years now. It's a weekly program. It's done in clinic. We have 20 to 40 family participants every week. We do a lot of data evaluation. We've actually incorporated a group visit model so that it's provider run, it's part of the patient's medical record, they're referred by their primary care provider. We've had some great outcomes and some great successes, and we're happy. We've now expanded over east of the river into southeast DC, which is moving from a mainly Latino immigrant population where we are now to primarily African American population.
Yes, we are an environmental conservation agency, but we feel it's extremely important to get kids outside moving. We've been part of the WeCan partnership since 2007 when we launched our Green Hour campaign, and Green Hour was basically encouraging kids to get outside an hour a day.
We need to utilize, our parks and our facilities and get our kids moving, and giving them the tools as we have from the WeCan Energize Your Family has definitely help parents. I just finished up one of the programs, and the parents said the activity part that we did with them was probably the most important for them, because some of them they know it's important, they just don't know how to get their kids moving.
What is a portion size on a plate? So how do you know how much of a starch to use, how much of a fruit and vegetable? We worked with WeCan, and so if you actually take 2 light bulb sizes, that is fruits and vegetables. That's how much you should have on your plate. And if you have a baseball, that's the size of your starch. So actually, when you think about it, it's a lot smaller than, glomming on a whole thing of whole wheat pasta or of starch. So it's giving parents those kind of fun, engaging strategies to work with the messages so that they actually think about it when they're preparing a meal or serving it to their kids.
We focus on Asian youth empowerment. We let all children be part of the program since the school system is very diverse, and we have Vietnamese, we have African American, Hispanics, and other Asian. We have the students cook or make food, which is really exciting because that's when we get to draw the students in, because it's like, oh, today we're going to make this. And so they come in and it helps them to come back to the program. And so we integrated the weekend program in because that's part of the program, which part of it is the nutritional aspect and the other part is physical activities, and they enjoy doing that as well.
We first became involved with WeCan a couple of years ago. We partnered with them to do a webinar to introduce our memberships to the program, and it was by far one of the most popular webinars that we have ever held.
If we're not going to save our children, who are we going to save? And we all can do something about it. We all have the ability, each and every one of us has the ability to help solve this issue.
It warms my heart to see such attention to this major public health problem.